To get started, my name is Dr. Alexandra Smith. I'm from Nirvana Naturopathic Medicine. I'm super excited to be here with my colleague, Dr. Amy Morrison. We're both naturopathic doctors. I primarily focus on women's health and hormones. Dr. Amy, I'll let you introduce yourself and kind of tell us what you primarily focus on, and then we can present the topic and go from there.
Perfect. Yeah, I'm Dr. Amy Morrison. My practice also focuses on some women's health, but mainly some digestion and then chronic inflammatory response syndrome, which weight gain is a huge part of. So that's why we're both doing this topic. We kind of both delve into that realm with both of the things that we see. But that chronic inflammatory response syndrome has a lot to do with exposure to biotoxins, so mold or infections, Lyme, chronic fatigue syndrome, fibromyalgia, that sort of thing. So a little bit different, but we definitely connect on this topic for sure.
For sure. Yeah. Yeah. And so, for overview for tonight, we're going to talk about weight management, and where we're going to talk about how we work with diet, lifestyle, comprehensive testing, so that we can really figure out the root cause of what's going on and treat it appropriately. To start, Dr. Morrison, I'd love for you just to kind of share with everyone on the call how you start working with a patient who's dealing with weight gain or it has difficulty with losing weight. What's your thought process? What are you looking at? What key symptoms maybe flag for you, and how you work with someone with this?
Yeah, you bet. So I created this diagram for everybody to have screenshot just to kind of show the different aspects or how we approach weight gain or when someone's trying to lose weight. And so a lot of the times when people have attempted this before, they're looking more at like that energy expenditure, how many calories are actually burning throughout the day, and then the energy intake at the bottom here. So how many calories you're being consumed, and we're kind of looking at the ratio or the plus minus between those when we're just like looking at weight loss from that core perspective of calories in versus calories out. A lot of the time when people come into our office, they have attempted everything down this pathway, every diet you can think of, every type of exercise you can think of. And so we'll talk a little bit about that today, but usually where we will start if those things have been attempted before are going to be the other factors, and then addressing energy, sleep, and stress. And so for a big part for a lot of people, if your energy is poor, then a lot of the energy expenditure and energy intake is going to be impacted because you don't have any energy to do those things. And so we really focus on the counting our calories or trying to exercise. But if you don't have any energy or you're not sleeping, then those things can be impacted, or we start consuming more than we think we're consuming, but more just from an energy intake side of things there. So with like the kind of the basics, if we want to call it, resting energy expenditure, or daily energy expenditure. So when we're looking at these, we're looking at how many calories, let's say, your body is burning throughout the day. And so that is going to be dependent on how much muscle mass you have, their common like BMI, or that calculation that is a very rough calculation but a good starting point of how much you can consume. And then calculating how much movement we're doing. Are we having an office job? Are we sitting all day? Are we actually moving all day? Do we have an intentional exercise routine? Are we lifting weights, doing resistance training, or doing more cardio-based training? Calculating all of those from energy expenditure. And then you will see here for the resting energy expenditure, some of the things that a lot of people have looked at from a weight loss perspective, or if you do go to your primary care physician or family doctor, thyroid is a big one that is assessed for right off the bat. Typically, it's just the TSH that's ran in that blood work, which is some of the picture, not all the picture, but a good starting point there. And if that looks good, then we're kind of at a loss for the like energy expenditure if nothing is out of balance and everybody has this kind of dialed into what they think they are losing from a calorie perspective in the day.
Mm-hmm. Right. Yeah. Do you have people, like when you're first working with them, track through anything. Like oftentimes I'll use something like Chronometer where we just see like baseline, what is fiber intake, what's protein intake, just so we have a good baseline of what is kind of a typical week for someone. And then if patients have some kind of like watch or something that they track their exercise with, then sometimes we'll just make sure that that isn't an area that we need to just tweak a little bit, right?
Yeah.
Alongside kind of what you're explaining in terms of, looking at hormones, so important, right? To get a good assessment there. Oftentimes with thyroid, I'll go a little bit deeper and look at thyroid hormones that are actually being produced and looking at antibody production, because sometimes there's an autoimmune component to low thyroid function that is creating these symptoms of weight gain, low energy, right? So a super, super important one to rule out for sure.
Yeah.
But curious, your thoughts on tracking and what you tend to use for things like that.
Yeah, Chronometer is a great one. We use that a lot at our clinic.
Mhm.
Basically, what you can do is you don't have to do it for a long period of time, but just take a week, let's say, to use that or another type of tracking app just to see from a calorie intake perspective. You mentioned fiber. I know we'll chat about the microbiome with fiber in a second, but a lot of us are either super under fueling and we think we're eating more than we are, or we're over fueling and we think we're eating less than we are. So it's just a good starting point to see where we are actually at from that energy consumption perspective. And then I do think that, some sort of tracking device from a calorie out perspective, same thing with nutrition. We either overestimate how much we actually burn throughout the day, and then we're eating more than we think we should. But those ones are great ones. Yeah, I know you use Chronometer a lot as well.
Yeah, I really like Chronometer. The breakdown that it gives is just really simple to follow for people. And it's a Canadian app, which is kind of cool. So anything that you buy at Community or Costco or wherever you shop shows up in there, which is pretty sweet. So it's just easier to add things in to a platform like that is Canadian instead of American.
That one too is good from a micronutrient perspective. I find a lot of them don't. Incorporate that.
It does a really good job of that. And I mean, why don't we dive into fiber in terms of why it's important? What kind of fiber goals do you have your patients work with when they're primarily focusing on weight loss or things like that? And then maybe we'll touch on protein too.
Sure. Yeah. So fiber perspective, I mean, kind of with all of calories, water intake, it's should be based on body size, let's say, but a lot of the guidelines are, I'm going to say gender specific, but I'll say anywhere from 25 to 35 grams a day of fiber there. Definitely if everything is working appropriately and your diet's not super low in fiber, then this fiber intake should be okay for people to consume. I know a lot of times with weight gain or trying to lose weight, bloating can be an issue. And so with that fiber intake, if you're going from 10 grams, let's say, and jumping right to 25, it can feel uncomfortable for a little bit of time. So definitely trying to increase that slowly, just to help mitigate some of those side effects that aren't always pleasant with that. But so from a fiber perspective, 25 to 35 grams, and we're aiming for the standard whole foods diet, of course. And if we're adding anything in, potentially some psyllium husk, chia seeds, flax seeds, that sort of thing that can help with other things, or there's other benefits to those as well.
Right. Actually, maybe before we go into protein, you can explain why fiber is beneficial for weight management. What's the benefit of eating fiber? We'll touch on the gut microbiome later, which is of course super important, but from purely just like why we do it when we're trying to lose weight.
So fiber is a couple of reasons. So one, it can slow down transit time. So as you eat fiber with your meal, it will reduce the way that your blood sugar spikes and then therefore your insulin, which we'll get to in a second as well. So that's a big one. It can be really filling, so you can be full for longer. So after eating a meal, if it's something super quick in carbohydrates without fiber in it, and then 20 minutes later you're having another meal, that's definitely not going to be helpful from a calorie perspective and weight loss if we're just looking again at this narrow calories in versus calories out. So it can help slow down that absorption. You can be fuller for longer, which is really important from that standpoint.
100%. Yeah, and mitigating that spike, like you said, right? Where when we eat things with fiber, the sugar that's attached to it, like with a fruit or vegetable, can't get into the bloodstream as quickly. So we don't get that huge spike. And that spike of sugar then inherently causes a spike of your insulin. And then our bodies can just be on a little blood sugar roller coaster for the rest of the day. So for a lot of people, and this actually will tie into protein here, when we're our first meal of the day, when we're breaking that fast at breakfast, we want to pick something that has, usually I recommend at least 20 grams of protein in the morning, right? Where we're not going to have that huge spike. So we're not just going for like coffee with sugar in it or something like that, or a cookie where we get that huge spike of blood sugar. If we have something that's really rich in protein, we're setting ourselves up for the rest of the day that our blood sugar regulation is going to be much more stable.
Yeah. Yeah. And even like just with breakfast with that protein, lunch, dinner, there's going to be other benefits of protein with that too. So especially from a weight perspective, again, all of our hormones, making sure we're not on that roller coaster, helping with our sleep, even just from a muscle mass perspective. So ideally, we're all exercising or doing some sort of movement. We want to build that muscle mass. Having more muscle mass will lead to more energy expenditure throughout the day. So making sure we're having those building blocks in order to do that.
Totally. Yeah, completely agree. Can you touch a little bit on the testing that you look at when a patient has done all of the kind of base dietary things that we're talking about with calories in, calories out expenditure? Patient comes in to see you, they've done all these things already, their diet looks solid, you're happy with how they're moving. Where are you going next? What's kind of what you're looking at, and what are some other areas that need to be investigated?
Totally. So yeah, you mentioned briefly about the thyroid, which is definitely kind of the next one there. So even if that TSH, which is that common thyroid hormone to be looked at, you mentioned the anti-TPOs, which is the Hashimoto's, or an autoimmune condition with the thyroid, that can be elevated even before our TSH gets super high. So that's going to be something that we're looking at, making sure that T4 to T3 conversion is happening as well, just to make sure that thyroid picture is looking really good. Most of the time it is for people by the time they end up in our office. We'll go all the way around the circle here. So then we're looking at cortisol. So a lot of the times if cortisol levels are high, that is like our hormone. Ideally it spikes 30 minutes after we wake up. It gives us the energy throughout the day. But when we're in a chronic fight or flight, chronic stress, work, life, kids, whatever it is, and you're in that fight or flight response all day, it's going to tell our body that we're more in that survival mode. And when we're in survival mode, I always like to think of fat or calories as if our form of energy. And so if we're in survival mode and our body thinks that we need to store energy just in case for the future, when we're in this survival mode, we might not have that energy, it's going to pack it on, right? It's not safe. We don't feel relaxed in order to burn those fat stores and burn that energy and get rid of it. So we're looking at cortisol there. Part of cortisol or the nervous system, we do a lot of like brain mapping and looking at the nervous system in our clinic. But if you are in that fight or flight, looking at what is actually driving that, is it more of a lifestyle issue? Is it more of like a thought pattern issue that's driving us, that makes us think we're in that survival mode? Is it a history of trauma that it allows our brain to be stuck in that survival mode that's causing cortisol or adrenaline to be high for long periods of time? So we can test for that, whether it's cortisol through blood work that can be done by your family doctor, or saliva testing, which we usually do at our clinic, or that brain mapping just to look at cortisol.
Yeah.
And then the hormones up here, insulin and leptin, very common to be insulin from a blood sugar perspective. Like you mentioned, if you're having some sugar-rich foods, our insulin levels typically ideally spike behind it, a little bit elevated, more elevated than glucose, but not too much. Stores that sugar appropriately. We go on, everything looks good. But what we typically don't see in testing is fasting insulin, which is a huge one. And the ratio between fasting insulin to fasting blood sugar, the ratio between those two is actually what's really important. Insulin, again, is what stores that sugar or that energy that we eat from food inside cells. And if you do have that insulin resistance, or those cells are not allowing the blood sugar or sugar from the bloodstream to get into the cell, the insulin levels continue to climb, and they get elevated well before we even see blood sugar rise on blood work. So definitely a blood sugar just by itself, or hemoglobin A1C just by itself, is not the full story. And if insulin levels are super high and our cells that we have already are not answering that call, let's say, and allowing that sugar to be put into the cell, our body then will create a new fat cell. And then it's again, it's kind of like cortisol in that sense of we just need to store. And until we can get insulin levels down, then weight loss is definitely going to be a little bit more tricky. It's not just a calories in versus calories out, because every calorie in is getting stored.
Yeah, and kind of like one key thing with that, if someone does have higher insulin levels, there's lots of different herbs and nutrients that we can think about using, right? Things like inositol or chromium, NAC, all have really good research on them, right? In terms of helping with sensitizing cells so that you don't require as much insulin. But there's also a key thing that everyone can do that helps to reduce how much insulin you need after a meal. And that's just walking after breakfast, lunch, and dinner. Usually about 10 minutes. That little bit of exercise, and even just going for a walk around the block, helps to open the cells so that glucose can be taken up. And exercise is the only mechanism we have that doesn't rely on insulin for our blood sugar regulation. So that's usually a key thing that I'll have on board if we do see a higher insulin, right? Especially in comparison to that fasting glucose, like you mentioned, Amy, that we'll look at adding or incorporating that in as much as we can. And that can really, really help with reducing the amount of insulin someone might be secreting.
Yeah. I don't know if we want to chat about estrogen.
Totally. Yeah. So, I mean, estrogen being one of our main female hormones for women, estrogen is really, really important for the sensitization of insulin too. It makes insulin, when it binds the cell, it's much more effective when estrogen is on board. So this can be a reason that we do see some changes in our blood sugar regulation as women go into menopause, or if someone's not secreting their insulin properly before they've gone into menopause, right? But it's very, very common in menopause that we see that estrogen drop off. And then another thing with estrogen that can happen when we go into menopause is that a way for our bodies to produce estrogen in menopause is through fat cell. It's through something called aromatization that happens in adipose tissue. And so our bodies will use that mechanism through fat cells. So sometimes we'll hold on to more weight so that we have more ability to use that mechanism to make a small amount of estrogen. So estrogen can be a little bit of a double-edged sword in menopause, right? We want it for that insulin sensitization, but then in order to get it, we sometimes will see a bit of weight gain in menopause because of that, because it's a way for us to create that estrogen. Hopefully that makes sense to everybody. But that can be a factor with our sex hormones in particular for women. With leptin, I'd love for you to kind of like start the conversation. I feel like leptin is not a hormone that's often talked about. Super common in chronic inflammation, like you talked about, that will rise. But how does leptin work? What does it actually do in the body? And why is it a factor in weight gain?
Yeah. So if you like leptin for weight loss, commonly paired with ghrelin, which they are talked about as our like kind of hunger and satiety hormones. So if everything is working appropriately, ghrelin, when that is secreted, you'll feel hungry, you eat food. When when you start to get full, there's enough food, ideally your body secretes leptin, tells everything that you're not hungry anymore, you stop eating, and that would be like the appropriate cycle that ideally would happen with these hormones. When there's chronic inflammation in the body, so again, if that's mold exposure, certain types of food poisoning, if you've had root canals in the past, if you've had a tick bite, Lyme disease, co-infection, some viral infections, they can all promote chronic inflammation. And what that inflammation does is it will damage or cause the receptor that leptin is supposed to bind to not work anymore. And then leptin can't bind to that receptor anymore. And so when we look at blood work for leptin levels tend to be very high in chronic inflammatory conditions, or if you have been exposed to these. And it doesn't make sense, because if your leptin is high, you should not be hungry. But because it can't bind, there is no downstream effect of that. So there is no kind of off signal there for it. And sometimes people will have elevated hunger or kind of appetite swings there, but sometimes people won't. And leptin levels just being high, they kind of act similar to insulin, that you will not be able to break down that energy or those fat stores if your leptin is high. And this is kind of the top step that, say, you mentioned, like if everybody comes in and their calories are good and their exercise good and their blood work is looking phenomenal, you can see a little bit with triglyceride elevation if that is on your kind of standard blood work. If that's elevated, it can provide insight into leptin also being elevated, because your body's not able to utilize that fat for fuel as efficiently as it could before. And so when that leptin is high, it is the common, I can't lose weight even if I tried. You look at something and you're gaining weight, like weight gain is coming on even though you are doing everything picture perfect. And it's like, okay, let's look at your leptin. And so the kind of catch to this as well is that our fat cells that we do have also secrete leptin. And so leptin levels continue to increase. And basically the more weight you gain, the more leptin levels you have. And then you have multiple factors working against you. So that chronic inflammation damaging those receptors is really something that is huge that we work with also. Definitely, I see a ton in that chronic inflammatory response syndrome that weight gain comes on, and unless we can get those leptin levels down, it's a very difficult one.
Mm-hmm. Yeah. And then with that, of course, we want to figure out what is the trigger to the chronic inflammation, right? And treat that appropriately. While you're doing that, while you're figuring out all of this, is there something that people can do for leptin levels in order to start at least trying to move things in the right direction?
Totally. Yeah. So like you mentioned, of course, figuring out that trigger, reducing inflammation is going to be a huge one. Mm-hmm. The other thing actually that people can do right at home to start is light exposure. So controlling when they are exposed to light throughout the day, which I know many of us have heard before, but being very diligent. And so leptin is also one of the hormones that is going to be part of our circadian rhythm in controlling that 24-hour kind of sleep-wake cycle, our cycle in our gut. And so first thing in the morning, ideally within an hour of waking, let's say, but it's going to be a little bit different with time change and where we live, but within an hour of that sun coming up, or within an hour of waking, getting outside, seeing some sun, getting those photons in the eye, that's going to help start the sleep-wake cycle and that 24-hour clock there. And then the lack of light at night. So a lot of people are also aware of not being on computers, TVs, phones before bed. But if you are, a blue light filter, and then anything overhead lighting, so anything that basically light, or a lot of the LED and more efficient lighting that has a lot of blue light will come into your eye at this angle, which is also signaling the body that's noon or midday. And so that will also throw off your leptin levels. So anything overhead, turn that off. Anything eye level, or lamps that say salt light lamps, those are fantastic. Anything with more of that red orange hue for lights is going to help control that, help bring those leptin levels down.
Right. With us kind of being into the super dark time of year, do you recommend red light therapy, any kind of SAD lamp? That, of course, is just blue light. So usually I won't recommend an only blue light for something like this, because it's actually detrimental, right? Yeah. But seeing more of those kind of like red light therapies can be really helpful. But would love to hear your thoughts on like how you time it through the day for people if they are at work before sun has come up and leaving when it's dark.
Yeah. I mean, ideally, best case scenario, I always try to get people, I'm like, even if you can just stick your head out for 5 minutes, like roll down your window when you're driving to work, just something is going to be better than nothing. Yeah. A lot of talk recently, or at least I've seen online with all of the social media, but like red light therapy, or like those lamps or face masks or whatever it is, that really I do throughout the day whenever, just from a inflammatory perspective. And so those red lights are going to help with mitochondria, which are going to be part of our cell that produces energy. And so they're going to be more efficient. That can help reduce inflammation, which overall can can bring those down. But from a blue light perspective, yes, I agree. Those are like there's other benefits to them, but for a leptin side of things, they don't do the same work as that sunrise and sunset. So ideally, if we can just watch that, that would be the best.
Totally. Yeah, I completely agree. And yeah, like you said, we don't need a ton of time outside. It's really 5 minutes 3 times a day. So the more we can incorporate that into just like baseline lifestyle factor that you're doing on a daily basis, the better. Of course, I tell my patients, like, if there's a day you can't get outside, it's okay. You're not throwing off an entire protocol by not being able to do it. But the more that we can get that natural light, and really important to know that what you get through window at your office or at home when the sun is shining through is not the same as being outside. So you do have to bundle up and get out there. Same thing with if you're wearing sunglasses, those will block some of the spectrums of the sun exposure that are key for something like this, for helping to reduce that leptin. So sunglasses off for 5 minutes. And then if it's super bright out, like it is generally in the winter here in the middle of the day, after 5 minutes, pop your sunglasses on, that's fine. But have that 5 minutes of unobstructed light, and that can go a long way to helping with that reduction of that leptin.
Yeah. And if we have to pick one, okay, you can't do it 3 times a day. You can't go for walks after meals, which is all picture perfect.
Yeah.
Usually I say just try for the morning. So that morning light will actually prevent some of the damage from the later, like the blue light later in the day. So at least yes, you're starting your circadian rhythm. All of your cells are going to be on the right clock, but then you're also preventing some of that damage. I know for us, we're on our computers all the time or indoors. So it's more about, okay, how can we actually prevent the long-term effects of all the blue light that we're exposed to later in the day? Then that can help with leptin as well.
Yeah, totally. And there are great apps out there for anyone interested that do follow the rise and fall of the sun. One is called Flux.
Yeah.
I'll put it in the chat in a second here, but that one it's more of an orange hue until the sun rises, and then it's a little bit more of a brighter screen. And then as the sun sets, it goes back to that orange hue. So less blue light exposure. Of course, it's not perfect. We're still looking at a screen like we all probably are right now. But it reduces the amount of blue light exposure that you're getting, which can really help in a case where there is that leptin resistance. And that's the reason for the persistent weight gain.
Yeah, big one.
Cool. Well, why don't we dive into the gut microbiome? What do you assess for gut microbiome? Well, first off, why don't we just talk about what the gut microbiome is?
Yeah.
And then we can kind of talk about like how we assess it, what comes up on a gut microbiome test that is indicative of affecting things that can affect weight gain. And then we can kind of talk about treatments and stuff too.
Sure. Yeah. So the gut microbiome, or the term microbiome, basically means any of the organisms that are living in our gut. So if we basically think as the mouth to the bum is a big hollow tube, still part of the outside world, it's going to be lined with hundreds, trillions of bacteria, yeast, parasites, worms, everything that we're exposed to. We're voluntarily putting food, drinking water from wherever it comes from, cooked or not cooked. And so there's going to be a ton of bacteria and other species that say, or organisms on there that we want to make sure that are healthy for us. And if they're not, that we have mechanisms, stomach acid, to kill them off so that they're not disrupting our health. And so we want to make sure that that microbiome, or all the mixture of all of those organisms, are in the right place, doing what they need to do, producing other molecules like short chain fatty acids for us. And so if there is if weight gain's the only symptom, then we're going to test for a lot of other things first. But commonly there is some bloating, gas, issues with bowel movements, heartburn, nausea, other symptoms that can be also correlated directly to gut health or the gut microbiome. And so we use stool testing. And so what that will actually do is, there's a couple different tests, but we're looking at the DNA fragments of all of the different species that we can test for in that microbiome. And then we're looking at different cultures to see what's growing, to see what's actually effective at killing them. So whether that's antibiotics, antifungals, or herbs that we can use in order to rebalance that microbiome, we're looking at that. And then, of course, how well are we digesting and absorbing our food? That's going to be a big one if we're just eating and not absorbing anything, or we're having undigested food in the stool, we know that that's not effective for our energy and therefore able to exercise, what the immune system is like in the gut, how much inflammation we have in the gut. So we can do a stool test to like kind of give us an overall health panel of what is in the gut and how well is it actually functioning there. And then the reason that that's important is certain species in the microbiome, so certain bacteria and or parasites that we hear about a lot with some weight stuff will impact blood sugar. And so, and how well we control blood sugar, back to the insulin topic, how well can we support that insulin, blood sugar spike, and then insulin that follows that.
Yeah. And kind of the key thing, if people have had microbiome testing done, there's 2 key bacteria categories that have been studied in terms of the ratio between the two. That's called the firmicutes and the bacteroidetes. And if you have higher amounts of firmicutes than bacteroidetes, then that tends to push up insulin, and your blood sugar regulation is affected by that. And so, like Dr. Morrison said, oftentimes there can be some kind of overgrowth in the gut, right? Where there's like a parasite or a bacteria that we don't want in there. But the firmicutes and bacteroidetes are actually strains that we want to see in the gut, but they can be imbalanced where we have too much of one versus the other. And that creates that insulin effect that can create that weight gain that we talked about earlier tonight. So that's a really key thing that I generally will look at with gut microbiome when we're assessing for not only the symptoms that are within the gut, but then also weight concerns, because that can be a key factor. And then yeast is another super common one. Yeast is commonly an overgrowth in the gut. We wouldn't categorize it as being what's called dysbiotic or some kind of infection, because it does naturally colonize in the gut. It's when it grows out of control that it becomes a problem. I would say it's probably top 3 in terms of the most common thing I'm treating in the gastrointestinal tract. It is super, super common. It loves to feed on sugar, and actually can, because there's a nervous system that is connected from the gut to our brains, it can actually communicate with our brains and create sugar cravings for us. And so if we're feeling like we always want sugar, or we're having like crazy sugar cravings that we can't get a hold of, that can sometimes be the yeast talking that's in your gut microbiome. And so getting an assessment done for that and treating it appropriately can go a long way, right? Because we also shut down the sugar cravings that could be a factor with insulin regulation and all that kind of stuff that we've talked about previously. So that's a huge thing that I look for in the gut. Is there anything else, Dr. Morrison, that you look at that might flag for you when we're thinking about these kind of things specifically?
For digestion?
Yeah.
Yeast does. Yeah, that's a big one for me too. I see that all the time as well. And usually part of the gut overall, not necessarily anything specific from the bacteria standpoint. Like, of course, we're looking for those big ones that can impact that. But a lot of the times too, I just find with the symptoms with digestion, it can be really hard from a weight loss perspective or weight gain perspective. When people are feeling bloated and they feel icky, and when they eat and they're not feeling great, then that really can impact. And or like you think you've gained weight and really you're just like holding a ton of gas in your system, then that's a big one too.
Yeah, that bloating, totally. Yeah. Also too, oftentimes with the gut microbiome, if there is some kind of growth in there that shouldn't be, fiber affects it. So people try to eat super healthy. They're trying to eat salads or lots of cruciferous vegetables like your broccoli, cauliflower, Brussels sprout family, which are beneficial to us for so many reasons. But if that gut microbiome's off, it's going to cause wicked bloating. And then that's really painful. And so oftentimes we'll ditch fiber when we have concerns in the gut microbiome, and then we are inevitably having to eat something else. So a lot of people will eat more processed foods because they're just easier to tolerate. There's less fiber in them. It's not affecting your gut microbiome. That's a huge indication that you should get your gut microbiome tested and treated appropriately.
And even just with that, I find a lot of people will notice that their clothes are fitting better, and it really isn't about a a weight gain perspective. It's just that you were uncomfortable.
Really.
Yeah.
Yeah.
Yes.
Yeah. With that bloating, do you notice a pattern through the day? I usually notice that it's once people start eating that
Yeah.
they start to experience that bloating. And then by the end of the day, some people will quote that they look 6 months pregnant or 9 months pregnant. That's really, really common when there's some kind of gut microbiome issue.
Yeah. Yeah, absolutely. And I've had a few cases where it's even just anytime you drink water, like anything anytime you put anything into your body, you're just, that bloating starts, that distension starts, and it's really uncomfortable. So typically common, or better with, I should say, unhealthier foods, if we want to label it like that, more processed foods, more fast foods, people can feel better with versus the salads. And then, yeah, as soon as you wake up, you feel okay. And by the end of the day, you're not okay.
Yeah, totally. Can you touch a little bit on sleep apnea and weight gain and why that's a factor, why people should be assessed, and how we might know whether or not we should be assessed for something like that?
Yeah. Yeah. Oh, yeah. I'll start with the assessment. I think, of course, if you have a partner at home or someone who's told you that you snore or will wake yourself up and sound like you're not breathing through the night, then definitely talking to your family doctor and getting a sleep assessment test would be the best thing to do. A couple factors here. So weight gain can lead to sleep apnea. So potentially you never had that issue before and now you do. But also sleep apnea or not sleeping appropriately can also lead to weight gain. And so a few mechanisms there. So one, when we sleep, that is going to be when we release testosterone, we can build muscle, therefore we can lead to more like of that, again, that basal metabolic rate can be higher. So if we're not getting good quality sleep, we're not going to get any of that building, muscle building with that. Part of that too is with sleep apnea, if you are not getting enough oxygen, your brain is going to go into that fight or flight state. We're not getting enough oxygen. You have oxygen deprivation. You're going to release adrenaline. You're going to release cortisol. You're going to go back into that survival mode. And so that will also lead to more weight gain. So yeah, getting sleep, like having proper sleep, making sure everything is, you're getting into the good quality deep rest for the testosterone, but then also just not getting that fight or flight response. Both of those are going to work against you with that apnea.
Right. Yeah. And with that, when people have corrected their sleep apnea, have you noticed, have you seen that people's weight usually does change right away? Does it take time? Is it more so that like that's a piece of the puzzle and then there's usually something else as well?
Usually, yeah, usually that's just a piece of the puzzle and there's something else as well. People can notice though, just by correcting that, again, we kind of come back to this full loop circle. If you have more energy, and then when you have more energy, you can work out better. You can actually prepare food that you want to eat versus grabbing those quick processed foods or sugar rich foods just to give yourself the energy. So usually there's a couple factors that follow it, but most, like the big ones are going to be like, yeah, okay, you can actually build muscle now. You actually have the energy to do things. You can actually work out. You feel rested upon waking versus when you do have that sleep apnea, kind of all that goes out the window and you just don't feel good. You just don't feel rested when you wake up.
Totally. Yeah. Yeah. With kind of like other areas that we maybe haven't talked about yet, is there anything else that you can think of that you look at for testing? Have we kind of hit all the main ones? Other like sneaky areas that we haven't maybe talked about yet?
Yeah, so the couple ones that we just haven't touched on here, so or briefly did, I should say. So certain medical conditions can, of course, be impacted or like cause weight gain. So PCOS, we see a lot. That comes back to the insulin side of things for the most part. Diabetes comes back to the insulin. So there are certain medical conditions that we definitely want to do some further testing that haven't been on this page, that just to rule things in and rule things out of what the mechanism of that weight gain actually is. Of course, there's some medications that people can be on. So certain antidepressants, certain like steroids can lead to weight gain. Definitely from our perspective, whether it's direct or indirect, some birth control and can lead to some weight gain or with that. So it's just assessing kind of the full picture of what's actually happening, diving into some of the causes, and then figuring out what's actually at the root of that for people. And usually it's more than one thing, right? So again, if your diet's in place and your exercise is good, usually it's not just like one hormone that's out of whack. Leptin and insulin work pretty closely together. Leptin and thyroid work pretty closely together. Cortisol impacts thyroid and the conversion of T4 to T3. So if we look at the whole picture and actually find out which of these hormones are being impacted, then we can help support the body as a full unit. And then usually it makes it easier for people to lose weight, and or it's not as frustrating because there's actually a reason why. And one of the biggest things that I see when people do come in for weight loss is frustration. It should, again, in theory, or when we look at the research behind it, calories in versus calories out, but it's not that simple. If it was that simple, weight loss wouldn't be difficult at all, but it usually is quite difficult. And so it is just about having that full picture, looking at all of these that say like 5 different rings here, and see where we can optimize and what we need to look at, what we need to add, remove, fiber, protein, that sort of thing, light, making sure all those things are being optimized, and then finding what hormones in the body are working against that, let's say. Yeah.
Totally. And I think this is the benefit of kind of where we fit when we do an initial consultation, right? Where both Dr. Morrison and myself, we take 90 minutes with our new patients so that we can do this deep dive into all of health history, right? So that you can kind of put the pieces together in terms of what is indicated to look at and what's maybe not. Right. And that is really helpful to kind of like build the picture. And that's why we ask such key questions around water damage building exposure in terms of potentially some chronic inflammation or a tick bite or things like that. Right. But then also a full hormone assessment is being done in terms of all the symptoms around that piece too. And same with gut microbiome, because it allows us to understand what avenue we need and what we need to prioritize for testing. Or if we do need to test every single one of these areas, right? Because not everyone who presents with weight gain is always the exact same testing that's recommended, right? Because we are all different. So we want that to be individualized and specific and targeted to you, right? And then same thing with the treatments, right? In terms of optimizing, like you said, we want to make sure that that is targeted and specific to each person, because we are all different and we all present differently in terms of the symptoms we're experiencing.
Yeah, and people might actually have, it's awesome when people already have lab work that they can bring in. So it's not even we might not even be just starting from square one. They might have had their estrogen, progesterone, thyroid checked already. So we already can check those off the list of, nope, everything looks good there.
Yeah, totally agreed. Yeah. You mentioned triglycerides really quickly. That is a super common test that people have done. What's your reference range? Because I know what we look at is a little bit different maybe than what might flag on Alberta Health Services reference ranges. What would you consider to be elevated that would warrant further investigation into maybe leptin resistance?
Yeah, that's a great question. I think anything above 1 is typically elevated, and it should be below 1 is what we're looking for.
Totally. Yeah, that's what I'm usually looking at for my reference range, that above 1, we're not using that system as efficiently as we could, right? And a lot of kind of the work we do is that optimization of these things. And so seeing that triglyceride, especially if it's been tested multiple times and it's always above a 1, would warrant further investigation into that area. Another piece, like you do need to be fasted to have your lipid panel completed and done appropriately. So if you weren't fasted and your triglycerides were super high, that doesn't really tell us much of anything. That's just because you had food on board. So that's not anything to be concerned about. It really is when you're in more of a 12-hour fasted state, that if it is above a 1, that does warrant looking into a bit deeper. Yeah. Cool. Dr. Morrison, anything else that you want to share before we kind of dive into some questions here?
I think I'll just wrap this chart up, not too long. So just under the energy intake here, I just didn't touch on the neurotransmitters and gut peptides really quick. If there's a neurotransmitter imbalance, it can actually just drive us to eating certain foods. So your appetite can be higher than what it typically is. And also with lower levels of serotonin, we can crave more carbohydrate dense food. So looking at neurotransmitters, see how that impacts us. And then the gut peptides there, I didn't touch on, but basically when we eat, certain gut peptides are released that can signal to our system if we need more food or not. And so if those gut peptides are not working, then it can drive us to eat more food. So both of those are neurotransmitter and gut peptides will depending on which levels they are, but they will drive us to eat more than what we need. And then just the energy, sleep, and stress. I just can't emphasize that enough, that those are going to be pillars when it comes to weight loss. Again, it's not just the energy in, like calories in versus calories out. If those three things are off, then that makes everything else harder to do. So as I put on there, like it impacts our appetite, movement, food, mood. So that really is where I start with people. If those are off, we're figuring out why those are off so that we can optimize everything else.
Totally. Yeah. Couldn't agree more. Awesome. Well, why don't we dive into some of these questions that have come through? The first one is, does chemotherapy cause chronic inflammation?
That'd be a question for Dr. Best.
Would be a question for Dr. Best. Yeah. Neither myself nor Dr. Morrison really focus on oncology or chemotherapy in particular. In terms of biotoxins or infections that create what Dr. Morrison was talking about earlier, chronic inflammatory response syndrome, that's a little bit different than chronic inflammation from some other factor. With the chronic inflammation piece that Dr. Morrison was mentioning about the rise in leptin, that's really related to biotoxin exposure. So likely a bit different than what might be caused by chemotherapy.
Yeah, and just that, like the biotoxin exposure, so that's just going to be a toxin produced by another organism. So, that kind of like other organism piece, which I mentioned, like food poisoning, viruses, bacteria, that's going to be the toxins that they produce. So not a medication or anything like that.
Yeah. Next one, what would you recommend for probiotics and the number of CFU?
So that's going to depend. Typically, kind of the standard maintenance dose is anywhere from like 10 to 15 CFU billion. Sorry, not just by itself. Then the treatment, depending on what we're like, if you have really low microbiome, it could be up to 50 billion. If you're on antibiotics, it could be up to 100 billion. So yeah, the maintenance dose we typically put people on is kind of between that 10 to 15 billion a day. The tricky thing about that, just if we were related to the microbiome, is that potentially might still be too high for people from a symptom triggering perspective, especially if there's prebiotics in there, inulin, FOS, then you can get more bloating and gas from that.
Yeah, for sure. I would probably recommend looking at, one with bifidobacterium and lactobacillus at a 10 to 15 billion is a good maintenance dose, like Dr. Morrison said, and then avoiding any kind of prebiotic if you do experience symptoms of bloating already, because it will make things worse for sure. What prebiotics do is they just feed bacteria. And so if there is something growing that shouldn't be, it's going to make it worse. It's going to cause bloating. It's hard to give a specific recommendation because we just don't know what's going on. So with gut microbiome, always testing or discussing your symptoms with a practitioner is really helpful to figure out what the right fit is for you, because they are not all created equal and all have different ratios in terms of the amount of bacteria that are in there. Would the daily recommended fiber intake vary for someone with PCOS? Should it be higher or lower? This is a good question. I like this question.
Yeah, you take it.
Yeah. So usually I'll recommend around 30 grams of fiber is kind of what we're trying to hit for fiber intake. With PCOS, we want to make sure that we're eating. This could be a huge topic. So sorry, I'm trying not to make it like a really long-winded answer here, but we want to make sure that we're getting fibers from vegetables primarily, and primarily cruciferous vegetables. So your broccoli, cauliflower, Brussels sprouts, and you want to cook those. And then leafy greens are super, super important too. But we want to kind of hit that 30 grams of fiber. And then depending on what lab results look like, and if there is elevated testosterone, for example, then we would want to add in things like flaxseed that helps our body get rid of testosterone, but is also a great fiber source. So I wouldn't say that it necessarily needs to be much higher than what we would recommend for someone without PCOS. It's just that we might want to be more targeted and specific with what fibers we're choosing based on helping to support hormone detoxification with the fibers that we're using. Really good question. Would love to dive into that more with you, Yazel, if you're interested. Next question. Do we want to include grains and beans along with the vegetables for our fiber intake? I would say yes.
Yeah. Yeah.
For sure. These, like, the more diverse we can be with fiber in general, the better. The reason for that is that diversity feeds a diverse gut microbiome, and that helps to keep all of the beneficial bacteria super fed and super happy. So the more robust our gut microbiome is in terms of we have a bunch of different strains of beneficial bacteria in there, the better. We tend to have a more healthy gut microbiome, and we get all of the benefits of that, like the short chain fatty acid production from beneficial bacteria, the ability to break down our food properly, proper immune system function when we are feeding those beneficial bacteria appropriately. So yeah, the more that you can include grains and beans along with vegetables for fiber intake, the better. We just want to make sure we're doing it all in moderation, right? We're not choosing one thing only all the time.
Yeah, that's what like the rotation, kind of thinking of that, like eating in season, seasonally eating like that, then you have all these different types of fibers into your diet. But yeah, from an intake perspective, yeah, all the different fibers from all the different foods is fantastic.
Yeah, totally. Are greens powders healthy?
They can be. Like any other supplement or food product, I would say it's going to be super dependent on what is put in it. So I find green powders, depending on, if there's added sugars, of course, we're looking at that. But from a nutrient perspective, can be very beneficial for some people, especially if you're not getting in enough of the nutrients. Let's go back, if we do our chronometer and you're not getting enough of those micronutrients in, so basically all of the vitamins and minerals through our food, then they can be actually beneficial. And so with nutrition, I'm looking at good, better, best. And so they can be beneficial for some people. Same thing as protein powders can be beneficial for some people. If you're not getting enough protein in your diet, it's better to have these nutrients in our body than not. And so depends on the brand, I would say. Again, like if there's a bunch of fillers or kind of artificial flavors or a lot of sugars, potentially might not be the best, but overall greens powder can be helpful.
Mm-hmm. Yeah. Do you have any key ones that you recommend generally? I feel like the ones that community carries are really good.
Yes.
From what I've seen there. And yeah, just like reading labels is always good when you're picking up a new supplement, to make sure that there's not a bunch of stuff in there that you can't pronounce. That's a problem.
Yeah.
So as long as there's not that and it's coming from an organic source, I think greens powders are great, and can be beneficial in times where like you're traveling and you don't have access to fresh food. Bring your greens powder with you.
Yeah.
Or if you're in a rush and you just like haven't had a chance, of course, we always want to promote that whole foods diet, like Dr. Morrison just said, but they can be great in a pinch for sure.
Yeah. Yeah. And I find with like powders of a lot of this stuff, it's the one I like, you won't like, so everybody's a little bit different. I'm like, yeah, okay, I really like this one. I've had people come in and be like, that was the grossest thing I've ever tried. I'm like, okay, I got to start recommending these things because it's so personal. But yeah, anything that like community would have good ones. So
yeah, for sure. Do you have any protein powder brands that you recommend now that you just mentioned that you?
Yeah, I will tell you my steal on protein, but please buy individual servings first before you buy a big package. I know, so Pure Paleo actually by Designs for Health is like my favorite protein powder ever. It's a beef isolate. One, of course, taste is really great, but then also I find because it's beef, it's very gentle on digestion. And so some of the whey proteins that people have and some of the vegetarian, vegan, pea, hemp proteins that you can get to can drive a lot of bloating and gas or discomfort and skin issues, especially with whey. I see all that all the time. So that's going to be my go-to one with that. I actually haven't tried any other beef isolates other than the Pure Paleo, so I don't know if you have, Dr. Smith, but
Yeah, the
Yeah.
pure paleo is definitely my go-to for that one. And then if people are plant-based or want a plant-based protein and not whey or dairy or beef, then the Genuine Health fermented
Mm.
protein
Yeah.
is quite easy on digestion. It may cause some digestive issues in some people that are really sensitive, but with it being fermented, a lot of like the nutrients have already been broken, or sorry, the shells of the proteins have already been broken down a bit by that fermentation, and so it generally is much better tolerated for people. So a fermented vegan protein is an option too. One thing with vegan proteins, we want to make sure there's a complete protein there. So most of the labels will say that it is a complete protein, but because it's coming from a vegan source, if it was just a pea protein or it was just a rice protein, that's actually not a complete protein, right? So we want to pair those things together. So yeah, it's something that can be beneficial for people if they're tolerating that one well. I've tasted it. I really like it. But again, not all people would probably like it.
Yeah, that was the one I recommended Iron Vegan to somebody and they were like, no, but I enjoyed it. So yeah.
Yeah. Yeah. It is it's personal in terms of the taste with those things.
Yeah.
Another question, just whey isolates. Are you not recommending them, Dr. Morrison, or you do in some cases? We're just concerned about acne. From my perspective, it's just the acne concern.
Totally. Yeah. I like whey isolates.
Yeah.
I think that they are actually probably one of the better tasting ones. And definitely from like a mixing perspective, if you bake or anything like that, they are quite easy to incorporate. So I do like whey isolates that way, as long as you're feeling okay with them. Yeah, no more bloated gas and stuff. Then yeah, totally okay.
Yeah. Yeah, I would completely agree. One thing that's actually been studied in terms of helping with getting proper insulin secretion when our glucose goes high, especially in older patients, is working with whey protein. First, you want to figure out if your insulin's being secreted properly. So that's the first step before adding in something like a whey protein isolate, because if you don't need it, you shouldn't be taking it. But it can help with getting that insulin dose to manage blood sugar levels. Of course, we don't want a massive spike of our insulin. We just talked about how that's not beneficial, but it can help with just a loading dose of insulin secretion if there are concerns with phase 1, phase 2 insulin secretion for people. So something to think about, something to get assessed and kind of go from there if that is recommended. Jasmine, I see your question here. Thoughts about monk fruit, erythritol-free? If so, where could you find it? In relation to what for the monk fruit? Oftentimes this is found in supplements to make them taste better. So it can be added as kind of like a flavor additive that is all natural, which is great. To use instead of sugar. Totally.
Yeah.
I think that's reasonable for sure, right?
Yeah.
Similar to things like stevia and that kind of stuff, where we're not using a processed sugar fruit or a processed sugar source. Yeah, cool. Awesome. Well, that brings us to the end of our evening. So thank you so much to everybody that joined. Thank you for all your questions. Ways to get in touch with us moving forward. You can call Nirvana Naturopathic Medicine to schedule a discovery call so that you can get booked in with the right practitioner, right fit for you. You can also shoot an email to info@nirvanahealth.com. I'll pop that in the chat here too. And then we can get connected with initial consults. Both myself and Dr. Morrison are available for initial consultations. And we would love to work with any one of you. So thanks so much for being here. Thanks, Dr. Morrison, for all those insights. That was awesome. And yeah, hope to see some of you soon.